Now we will consider the role of the music therapist in helping the client. Music therapist should help the client to express themselves through improvised or composed music that focuses on specific patient issues, client issues. It should be a result-oriented, a client-oriented approach. And the clients can be encouraged to compose songs or music related to issues experienced by them during the hospital stay. That is a very active process when that happens. That will help to facilitate the expression of the client's feelings related to the here and the now, and the hopes, the fears, the soft thoughts, everything, so that it will be letting out of a lot of catharsis effect can happen with that. Improvised or recorded music also can be used. That is mainly for pain reduction and relaxation, reducing the stress, etc. So both can be used in combination as also. That depends on how the client can take it, and also how and what is the purpose of the intervention with music. So that depends on the unique conditions. The music therapist has to facilitate intrapersonal and interpersonal communication through improvised techniques. They have to help the clients in coping with the disease through music. This improves the quality of life of the client. In a music therapy group session, you can actually audio tape the group session itself so that the clients can hear them. The audio taped versions they can hear, and in and outside the sessions they can actually think about it. Thinking about it itself is a sort of therapy. Stimulating the memory, facilitating the realization, increasing the self-expression and socialization and self-esteem. Music therapy groups develop a positive, trusting, dynamic atmosphere where the clients are encouraged to explore new ways of self-expression and to experience great self-acceptance. And then positive feedback will naturally follow. The therapist also will be learning from such experiences from the clients. If we are giving familiar songs, they will activate the clients to move, sing, even they will sing along, and that will express their opinions more freely about various topics. So that will be an opening out of the interpersonal relationship between the therapist and the client also. Music is a facilitator of a process that incorporates established music therapy goals. Group therapy sessions are conducted in Indian music from time immemorial as bhajans in temples. So this is a very ancient process actually. But individual therapy sessions has to be carried out in every clinic or hospital. These should be group therapy sessions. You may not need that much of planning because you are giving that to a variety of clients. But individual therapy sessions are to be planned very carefully, and each of the clients should be assessed for the musical preferences and the musical background, which is called the musical life panorama or MLP of the client. A preliminary questionnaire can help, but also a few personal sessions with the music therapist and the client should be there. Not only the questionnaire, there should be very personal sessions as well. Only after the assessment of the client's musical background and the preferences, the MLP, the therapist can start thinking about which raga will suit this particular client. So every client is a unique person, and every client is coming from a unique musical environment. So you will have to choose selectively, carefully for every individual. That is why it's said that it should be planned carefully. And the lyric writing and Samasya Purana are done to facilitate self-expression for the clients who are cognitively intact. Most of our clients will be cognitively intact. For such people, it is better to have that type of sessions. But who have limited verbal ability, by writing lyrics, ask them to write whatever they want. It need not be a very big, great poetry and all. But by expressing through their poetry, the individual is able to develop a strong, trusting relationship with the therapist and can explore deeper and more meaningful forms of self-expression, which will be a self-healing experience for the client. This is the beginning of a therapeutic process for the clients. There is a group called the Beth Abraham Family of Health Services. There is a special group for the younger population, the children. This is an open group, and any young person can participate in it, no matter what their musical skills are. Everybody can participate. And another music therapy support group for relatives and friends exists separately. And having a loved one who is sick or maybe hospitalized is a stressful and an emotional experience for all the caregivers and relatives. In the music therapy groups, for these people, their feelings and experiences are also shared and processes in a musical environment. And the group provides help to the caregivers to feel more in control of the process and facilitates emotional release, self-exploration, self-expression through music. Techniques of music relaxation and stress reduction are taught in a nurturing and confidential environment. There should be a confidential environment between the therapist and the client. Both the patient, that's client, and the caregiver are invited together to participate in the session, and this will enhance communication between the caregiver and the client. Music functions as a bridge between the patients, between the caregivers like the relatives, doctors, nurses, etc. Actually, a bridge is created so that both the minds of these people can be linked. The caregivers are to be given assistance to select the best musical pieces or tapes or ragas, whatever. That assistance should be for the clients, because everybody hears some sort of music which may not be helping them, which may not be giving the self-healing experience. So assisting them to select the best thing for their healing experience is also important. And this is the responsibility of the music therapist, who has to find out not a single raga, but an assortment of ragas which will be suitable for a particular individual client, depending upon the musical preferences, that is MLP, depending upon the disease process, depending upon the organ affected, and depending upon the different chakras, that is the Ayurveda process, yoga process, the chakras affected, and depending upon the right or left side of the body is affected. All these things are carefully assessed, and then you give an assortment of ragas for each individual patient, because everybody has a unique environment, musical environment. They are coming from a unique personality, a unique disease, and also a unique need. So it is depending upon the need of the client. We have to select the assortment of ragas, the best suited ragas for them. And this is the challenge that the young music therapist should be able to take up. And it is in this process that we are training the faculty here in the Calicut University. The training, we are training them to select this type of unique selection. We are giving them how to do this. Only then they can be of help to the society.